Hey everyone, so our topic for our assignment is veterans experiencing PTSD. Our group members are Sydney Anderson, Kaitlyn Davies, Caroline Gibellato, Avery McDonald, and Lexi Woods.
So, what is PTSD? PTSD is known as post traumatic stress disorder, and it often occurs in individuals who have witnessed or experienced traumatic events themselves. It is extremely common within the community of veterans, and there are a bunch of symptoms, but some of the most common ones include flashbacks of the specific event, inability to concentrate or complete everyday tasks, depression, anxiety, feeling emotionally numb, or the opposite, overwhelming of guilt and shame. With PTSD, there are two types of therapy that are the most common. The first one includes CBT, which is cognitive behavioral therapy, and psychodynamic group therapy, PGT, which we will be discussing throughout this presentation.
So what is CBT? CBT is cognitive behavioral therapy. It is a type of psychological treatment that has been used to treat a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and other severe mental illnesses. CBT is a form of therapy that has also been used to help individuals with PTSD. It is a type of therapy that focuses on changing an individual's thinking patterns. This type of therapy focuses on how psychological problems are formed from unhelpful ways of thinking and learned patterns of unhelpful behaviors. There are many different types of strategies used within this type of therapy. Some of these include changing thinking patterns and behavioral patterns, recognizing your own distorted way of thinking, developing problem-solving skills to acquire better coping skills, gaining confidence in yourself and your own abilities, facing your fears instead of avoiding them, and then role-playing any possible triggering situations. Not all of these strategies need to be used. Some or all of them may be used. First, the individual will have a session with a therapist, and they will discuss the client's situation and what they're going through, and develop a treatment strategy according to that. And what is PGT? PGT is psychodynamic group therapy. It is when there's a group of individuals all experiencing the same mental problems, such as PTSD, depression, or different anxiety disorders. It's usually led by one or two mental health professionals. PGT is helpful because while you're learning how to deal with your disorder and develop coping strategies, you're also building a sense of community with people who are dealing with the same thing as you. Members of the community will share their past and current coping mechanisms and dive into how or why these current mechanisms are unhealthy, and therefore they can learn to develop more effective and healthy ones. PGT is aimed to help individuals understand their own unhealthy coping strategies and dysfunctional patterns in order to become more self-aware and begin to learn healthier patterns so that they have more confidence in their everyday lives. Sharing of past experiences help everybody in your group feel less alone. An example of something that's similar to PGT is Alcoholics Anonymous. All right, and then real application of both of these types of therapy. So there was a study done on CBT where there was 40 veterans, and they studied the efficiency of CBT for insomnia and nightmares in Afghanistan and Iraq veterans with PTSD. All participants reported that they had PTSD-related nightmares at least once a week. So every participant received 4 sessions of CBT where they were required to keep a sleep diary, and data was taken on their sleep patterns pre and post treatment. They were also required to self-report their sleep quality with a variety of indexes and scales, such as the ones listed. And then after answering those questionnaires, both pre and post treatment, the results showed that they had improved sleep quality, less PTSD related nightmares, and then just an overall increase of mood due to the decrease in stress from the poor sleep quality. And then for PGT, there was a study done to examine the benefits of it for treating veterans in general with PTSD. This study included 158 all-male veterans. They were assigned to one of 15 different groups, all containing about 7 to 13 patients each. I believe the mean was 10 per group. All of the male veterans had symptoms of PTSD, depression, and their level of functioning was assessed and recorded pre-treatment. All participants received 1 full year of PGT treatment. This included 1 session a week at 1.5 hours each, and as well as a 12-month follow-up post-treatment. There were multiple stages within treatment. They included group building activities, differentiation of group members, intimacy building, and termination. At the end of the 1 year, they all reported reduction in PTSD and depressive symptoms post-treatment, and then these results were also maintained at the 12-month follow-up. So what they said after the initial post-treatment was also the same that they said at the 12-month follow-up, and they also reported that their level of hope in life had increased.
So the research question we decided to go with was, or is, PGT a preferred treatment for veterans with PTSD?
So the participants in the study consisted of 25 male and female veterans. There were 15 male and 10 female. The criteria they had to meet to participate in the study included serving in the military, either Army or Marines, eligible for disability under Veterans Affairs Canada, and having a diagnosis of PTSD from a certified psychologist. All participants also had to have completed a 6-week cognitive behavioral therapy treatment and a 6-week psychodynamic group therapy treatment. Our statistical hypothesis was in 2018, the mean answer of preferred treatment among veterans was 12.31, choosing PGT. We took a survey of a random sample of 25 veterans diagnosed with PTSD and found a sample mean of 16.56 and a standard deviation of 5.10. So we are asking, do we have enough evidence that the mean preference for PGT has increased? And we are using a significance level of 0.05.
According to our hypothesis, our null hypothesis is 12.31. We have a random independent sample and our sample size is 25. And again, we're using a significance of 0.05. According or based on the data that's shown here, since our p-value is less than 0.05, we reject the null hypothesis because evidence should suggest that mean preference for PGT has increased. Therefore, we reject the null hypothesis because there has been an increase in the data.
The method we chose to use is a survey questionnaire. It included 5 questions, and the participants had to choose between a number 1 to 5, 1 being strongly disagree, 2 being disagree, 3 neutral, 4 agree, and 5 strongly disagree. If the participants scored above a 10, they would be inclined to prefer PGT. So each question is geared towards a treatment, such as you enjoy working in a group, which would tell us that they prefer PGT. So when we gathered the data to enter into Excel and SPSS to interpret which treatment was most successful. Some questions that were included, you can see here. So you prefer to work in a group setting, so they would choose between 1 and 5. Another question is you enjoy completing reflection work and you are comfortable sharing experiences with others. So these questions would tell us whether they prefer PGT or CBT. And yeah.
The data from the above survey concluded that the majority of participants had a score of 10 or higher, showing a preference for PGT. And then as you can see here, the participant scores are shown on the y-axis and the number of participants on the x. It is clear by this line graph that there is a steady high score count, which means that there is a preference for PGT.
So our statistical results from the survey state that the total sample size for our results is 25, and the mean for our study is 16.56. The participant score is what they scored out of 25, and stating again that the mean of 16.56 states a preference for PGT over CBT. We stated in our SPSS output that 1 was for female and 2 was for male. And the mean for the total of participant scores is 16.56 with a standard deviation of 5.1, making most of the data fall between the first standard deviation. Then we ran a one sample t-test through SPSS and found that the significance level is 0, making the data and the research conducted significant. So for our incorrect example of how not to input data into SPSS, we decided to switch our dependent and independent variables so that it would report an incorrect report. Just make sure that when you are inputting data into SPSS that you are making sure that you are putting your dependent variable in the dependent list category and the independent variable in the independent list. So for us, it would have been flipped. So our participant score would be the dependent variable and the participant sample would be the independent. But for the case of showing an incorrect example, we did flip them. And as you can see the report on the right side, that it was indeed incorrect.
And lastly is our discussion. So our original outcome relates to our hypothesis because it shows that we reject our null hypothesis, meaning that preference for PGT has increased. And again, this relates back to our research question of, is PGT a preferred treatment for veterans? Because it shows that yes, in fact it is.